All right, everybody, welcome back. Let's talk about some specific or some specific public policies that we have here in the United States. One example of policies that we have in the United States are social welfare policies. When we say social welfare, what we're talking about is we're talking about taking care of the masses. We want to take care of everybody in this country. Wasn't always that way. For a long time, we people were very self-reliant. That was the basic premise of the Constitution. Opportunity was the key, not the outcome. In today's world, it's shifted a little bit where people depend on the government for everything. Uh, because of the self-reliance, America's prospered for over 200 years. But unfortunately, a big chunk of our population is termed as underclassed. Those are in desperate need of assistance. Um, and the citizens are one example of social welfare policy where we help these people out. Um, Common misconception is that we give so much money to poor people, but in actuality, here in the United States, more federal money goes to non-poor than to poor people. Uh, Let me give you an example here. Uh, Example number one is Social Security and Medicare. Uh, those are programs that people get regardless of their need. It's just based on age, it's based on circumstance that has happened to you, but you get those benefits whether you need them or not. Um, we also have means tested programs where you have, where you need something specific. Uh, you need some type of health care, you need some type of surgery. You get them whether you need the money or not. The government will provide them for you. That leads to a big debate in this country: who are the deserving poor versus the undeserving poor. Uh, it's just a matter of perception. It's what you believe, it's what you think about, but that's what our government does. Our government takes care of us. They take care of the masses. Uh, who holds all the wealth in this country, guys? In the United States, the average median household income was $48,201. But here's the catch: 1% of the richest people in our country possess 37% of the wealth, which means they control most of the money in this country. When you're talking poverty here in the United States, uh, the poverty line here is $21,200. Um, that is greater than 12% of Americans. Uh, a lot of people in America fall under that poverty line. Poverty used to be something that was an elderly problem. Now statistics will tell you that poverty is an unmarried women and their children problem. They call it the feminization of poverty. That unfortunately many people in America today that are below this poverty line of $21,200 are unmarried women and their children. Another big social policy that we have in this country or another big policy we have, is the redistribution of wealth. And in the United States, we do that through taxes. Uh, our taxes in this country are progressive, or at least they're supposed to be. The more money you make, the more you're supposed to pay. Um, Big bite for the rich, and it's a little less than for the poor. Some people feel that taxes should be proportional, same bite for all. Some people feel there should be a regressive tax, a higher rate for poor. Um, like an example, sales tax. Other people feel that there should be a flat tax here in the United States where all people just pay 20% no matter how much you make. But if you do that, then who's going to give money to the poor? Other people feel that there should be an income tax credit. And we do this because the government sends you a check when you're poor. Government does those things because, again, it goes back to the we want to take care of everyone in this nation. We do redistribute the wealth of people. Just because you make a bunch of money doesn't mean you get to keep all of your money in this country. Sometimes the government will force you to share from other people, and that comes through taxes. Your money also gets shared with other people through government expenditures. They collect your tax money and they spend it on different things. They will also transfer money to pay for different things. Uh, Social Security payouts, your money goes to that. There's cost of living adjustments for those every year. Um, the government provides low interest loans for colleges. Government provides first-time home loans for people. There's also the government has welfare programs to get people to work. Um, and what they do here is, and they try to get people to go to work, or the federal government will cut your payments on your welfare. Doesn't always work out that way, but they try to get people to go back to work and get them off of welfare. There was a time where you could only receive welfare for a maximum of 5 years unless your circumstances changed. Problem is, there's no way to test this. People try these different things, and sometimes they work for a little bit, sometimes they don't. But here in the United States, we redistribute wealth in a lot of different ways, whether it's welfare, again, home loans, Social Security, and all that money that comes into the government comes through the taxes. Okay, the last policy we're going to talk about today is healthcare. Healthcare is a big one because the United States spends tons of money on. 1/7 of their gross domestic product, which is all the money that we make, is spent on healthcare. Unfortunately, death rates and infant mortality rates don't reflect that. People are still dying. Private industry spends about $500 per person on healthcare here in the United States. Just to give you an example of someone who has a national healthcare, Canada has national healthcare, and they spend $50 per person on healthcare. The HMOs control access to healthcare here in the United States, which leads to the fact that 16% of Americans don't have healthcare, and 13% of children in the United States don't have healthcare. Unfortunately, here in the United States, healthcare is just for those who can't afford it. There are lots of ethnic discrepancies in who has coverage and who doesn't here in the United States. It's just like anything else. The people with the money can get it, and the people without do not. If you belong to an HMO, which is a health maintenance organization, you should get good credit, but managed care has cut costs and limits patients' rights. Like we said, good care costs lots of money. Obama is trying to fix that. He's just rolled out his healthcare.gov website for anyone to sign up and get healthcare. And obviously that's had its ups and downs, but they're trying to work things out with that. Couple things about privatized healthcare. Government has allowed it to flourish. They give them plenty of tax breaks and plenty of payouts to medical professionals. U.S. guys, important to know, even with this Obamacare stuff, does not have nationalized health insurance. Harry Truman tried it in the 50s. Bill Clinton tried it in the 90s. Both of them failed. We have not nationalized our healthcare system. The thing that has helped out old people is the American Association for Retired People, which has lobbied to get drug costs added to the Medicare bill, and that has gone into effect already. That went into effect in 2006, and a lot of our older people in our country today are able to receive extended Medicare benefits because of this stuff. We're going to stop there for today. Remember, again, if you have any questions, make sure you see me in class, and thanks for watching.